Today's show is sponsored by Strawberry.me. Do you ever feel like your brain just never shuts off? Between classes, clinicals, exams, work, a lot of nurses and nursing students carry a constant mental load that doesn't always get talked about. Well, clarity and fulfillment come from having some space to slow down, reflect, and make intentional choices. Coaching can give you that space. It can help with things like test anxiety before exams, feeling overwhelmed in clinical, struggling with confidence at work, or trying to figure out how to protect your energy in a demanding profession. That's where Strawberry.me personal coaching comes in. Working with a coach gives you clarity, strategy, and accountability so you can organize your thoughts, work through what's stressing you out, and move forward feeling more grounded and confident. I've worked with a coach to help identify my goals, focus on what really matters in my career and my life, and boost my productivity. And when your mind feels calmer and you know where you're going, everything else gets easier to manage. Go to strawberry.me/nursemo and get 50% off your first coaching session. That's strawberry.me/nursemo. It's like therapy for your career. It takes heart to build bodies that break records. Over the last 6 years, a team of incredible healthcare professionals did what most people thought was impossible. They rebuilt the body of legendary Olympian Lindsey Vonn after a series of devastating injuries forced her into early retirement. Now she's headed to the 2026 Winter Games, ready to break records once again. This February in Milan, Lindsey's team and the entire USA medical team will be wearing FIGS. You can rock their official uniform too. The new Team USA collection from FIGS is engineered with Fiber X, the most durable fabric yet. Fiber X is the new gold standard for high-performance scrubwear. It's lightweight, breathable, and ultra-resilient. And of course, the styles come in red, white, and blue. Check out the limited edition Team USA collection and get 15% off your first order at wearfigs.com with code FIGSRX. That's wearfigs.com, code FIGSRX. Hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a quick shorty episode that I release on Mondays. And this one is going to look back at the episode that was released on Thursday. We're going to be doing a pod quiz about that topic. I'll ask a question, pause for a minute, give you time to answer, and then tell you the answer. It's a great way to test your understanding of the topic and prepare for exams or one-on-one with the patient at the bedside. And if you like this type of quizzing and reviewing of information, then you need to check out Study Sesh, where I go through pod quizzes on a ton of different disease conditions and must-know nursing knowledge. So check out Study Sesh if you enjoy this pod quiz. Let's get started. This pod quiz is referencing the episode that was released just last Thursday. That is episode 467 on groin management. What is the name of the device that will be utilized after the sheath is pulled to achieve hemostasis, and it is used in place of a manual hold? That device is called the FemoStop. There may be other brands out there, but that's definitely the one that I mentioned in the episode. StarClose, AngioSeal, Vascade, and PerClose are all examples of what? Those are examples of vascular closure devices, and they are a method for achieving hemostasis after sheath removal. Your patient has come to you after a cardiac catheterization, and they have a safeguard in place over their femoral venous access site. How many mils of air is in that safeguard inflatable dome? So that dome can be filled with 30 to 40 mils of air to be considered full. Most of the time, though, the patient will come to you with 30 mils of air in that dome. When you are palpating the groin site, what are you looking for? You're looking for it to be soft and non-tender. If you notice any firmness or tenderness, what could this be indicative of? That could be a sign of a hematoma. What if you feel a pulsatile mass? A pulsatile mass could be a pseudoaneurysm. What are the elements of the neurovascular assessment of the affected extremity? So you're looking at pulses, capillary refill, color, temperature, sensation, movement, and edema. Your patient has hypotension, tachycardia, and is complaining of flank pain. What could be going on? If these things were happening with my patient, I would be very concerned for a retroperitoneal bleed. Your patient had a CBC done before this procedure. What two labs are you looking at from this test? From the CBC, I am most interested in the patient's platelet level and their hemoglobin. So, for the platelet level, this is going to tell me about their bleeding risk, and I just want to know their baseline hemoglobin in case they do start bleeding. I have something to compare it to later. What is a standard duration of bed rest? Bed rest could be from 2 to 6 hours very commonly, but in some cases, maybe less. And in other cases, maybe more, but 2 to 6 tends to be pretty common. What's a very common complaint during this bed rest period that is not related to a complication with the vessel that was accessed? A very common complaint is back pain, and this has nothing to do with any problems with the vessel that was accessed. It's entirely due to positioning and the duration of the bed rest. What are some things that can increase intrathoracic pressure that we want the patient to avoid? So, those are things like coughing, sneezing, yelling, even laughing. Lifting their head off the pillow can increase intrathoracic pressure, and so can bearing down. Anytime you think your patient is at risk for bleeding, like say they're really restless, they're not holding still, or they're coughing, what would you want to do as the nurse? You want to put pressure on those groin sites. Very good. What size syringe will you have with the patient if you are managing a safeguard device? A 60 mil syringe. And what is the standard amount of air to remove from the safeguard bulb? It is 5 to 10 mils every 15 minutes. Now, again, this is just a standard. It does not mean it is what you will do with your patient, and your facility policy may be different as well. I'm going to go a lot more slowly if I've got a patient who is at higher risk for bleeding. If your patient starts bleeding and you're not able to manage it with a manual hold, what device could you use? You could use a femostop. Very good. I hope you did well with this pod quiz. If you didn't get a chance yet to listen to the episode about groin management, make sure you head back to episode 467 to check that out. Thanks so much for playing along with me, and I will be back in your ear in a few days. See you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Monster Energy. Everybody knows White Monster Zero Ultra. That's the OG. It kicked off this whole zero sugar energy drink thing. But Ultra is a whole lineup now. You've got Strawberry Dreams, Blue Hawaiian, Sunrise, and Vice Guava. And they all bring the Monster Energy punch. So if you've been living in the white can, branch out. Ultra's got a flavor for every vibe. And every single one is zero sugar. Tap the banner to learn more.